What if the real reason your blood sugar keeps rising has nothing to do with what you ate yesterday, nothing to do with how active you were this week, and nothing to do with medication changes, but something much more basic, something your body quietly runs out of without warning? Across the United States, millions of people with diabetes walk around with a silent mineral imbalance they've never been told about. Deficiencies that disrupt insulin behavior, slow your metabolism, drain your energy, tighten your blood vessels, and make blood sugar spikes feel impossible to control. The surprising part? These minerals aren't rare, exotic, or expensive. They're everyday nutrients your body depends on. Yet the diabetic body burns through them faster than most people realize. And when these levels drop even slightly, the effects show up everywhere. Poor circulation, nerve tingling, stubborn fasting glucose, irritability, fatigue after meals, restless sleep, and constant cravings. But here's the hopeful part. Research shows that restoring just three specific minerals can help improve insulin sensitivity, support healthier glucose patterns, boost circulation, and give your cells the fuel they need to work properly again. So today we're going to uncover exactly which minerals matter most, why diabetics become deficient, and how correcting those levels can completely shift the way your body handles sugar. Let's begin with number one. Magnesium glycinate is often described as a calming mineral, but for people living with diabetes, its role goes far deeper than relaxation. This form of magnesium acts like a metabolic stabilizer, quietly influencing how your body handles glucose, how your insulin receptors respond, how your nerves communicate, and how efficiently blood flows through your arteries. When magnesium glycinate levels are low, the entire system begins to struggle in ways that are easy to miss at first. Many diabetics experience early warning signs without ever connecting them to magnesium. Muscle cramps at night, tight calves, twitching eyelids, restless sleep, irregular heart rhythms, fatigue after meals, brain fog, anxiety, and that heavy drained feeling during the day are all common symptoms. In the United States, studies consistently show that more than half of people with type 2 diabetes are deficient in magnesium. The reason is not always poor diet. High blood sugar itself forces the kidneys to flush magnesium out through urine at an accelerated rate, slowly draining the body over time. As magnesium levels fall, insulin receptors become less responsive. Glucose struggles to enter muscle cells and instead lingers in the bloodstream, raising fasting blood sugar and worsening post-meal spikes. This forces the pancreas to work harder, producing more insulin just to achieve the same effect. Over time, this cycle deepens insulin resistance and creates unpredictable energy crashes that make diabetes feel exhausting and difficult to manage, even when meals are controlled. When magnesium glycinate is restored, the body begins to shift. Magnesium plays a key role in activating insulin receptors, allowing glucose to move into cells more efficiently. Research shows that adequate magnesium intake can improve insulin sensitivity by roughly 20 to 30%. As sensitivity improves, fasting glucose often begins to decline within a few weeks, and post-meal spikes become smoother and less extreme. Many diabetics describe this change as their blood sugar becoming more predictable rather than constantly reactive. Magnesium glycinate also has a powerful effect on circulation. It relaxes the smooth muscle surrounding blood vessels, allowing arteries to widen slightly and blood to flow more freely. This gentle relaxation reduces vascular resistance, which can lower systolic and diastolic blood pressure by several points. As circulation improves, oxygen delivery increases throughout the body. Many people notice warmer hands and feet, less heaviness in the chest, easier breathing, and improved stamina during daily activity. The nervous system is one of the biggest beneficiaries of magnesium glycinate. Magnesium stabilizes nerve signaling and protects the myelin sheath that surrounds nerve fibers. When levels are low, nerves fire erratically, creating burning, tingling, stabbing pain, numbness, and hypersensitivity, often labeled as diabetic neuropathy. With consistent magnesium intake, nerve signaling becomes calmer and more balanced. Over time, many diabetics experience reduced tingling, less nighttime burning in the feet, and improved comfort while walking or standing. Sleep quality often improves as well. Magnesium glycinate helps regulate neurotransmitters involved in relaxation and sleep cycles. Diabetics who struggle with frequent nighttime awakenings, restless legs, or shallow sleep often notice deeper rest after restoring magnesium levels. Better sleep further stabilizes blood sugar, creating a positive feedback loop where glucose control and recovery support each other. Magnesium glycinate also supports heart rhythm and kidney health. It helps regulate electrical signals in the heart, reducing palpitations and irregular beats. Inside the kidneys, magnesium prevents excess calcium from forming stones and supports smoother filtration. This reduces fluid retention, swelling, and strain on kidney tissue, which is especially important for diabetics at higher risk of kidney complications. Muscles rely heavily on magnesium glycinate as well. Magnesium allows muscle fibers to relax after contraction. When levels are low, muscles remain tight, leading to cramps, stiffness, and soreness, especially at night. Restoring magnesium reduces cramping, improves flexibility, and supports smoother movement throughout the day. Many diabetics notice less nighttime leg pain and improved mobility after consistent supplementation. Magnesium also plays a role in bone strength and vitamin D activation. Without adequate magnesium, vitamin D cannot function properly, even if levels appear normal on blood tests. By activating vitamin D, magnesium supports calcium balance and bone integrity, reducing fracture risk and supporting long-term skeletal health. Dietary sources of magnesium include pumpkin seeds, almonds, spinach, black beans, and avocados. While these foods contribute meaningful amounts, many diabetics struggle to maintain adequate magnesium through food alone due to ongoing urinary losses driven by elevated glucose. This is why magnesium glycinate supplementation is commonly considered. Magnesium glycinate is one of the most bioavailable and gentle forms available. The glycine component improves absorption and reduces digestive discomfort compared to other forms. Typical daily doses range from 200 to 350 milligrams, often taken in the evening. Evening intake supports muscle relaxation, improves sleep quality, and helps stabilize overnight blood sugar patterns. Excessive magnesium intake from supplements can cause diarrhea, dizziness, or low blood pressure, particularly above 500 milligrams per day. People with kidney disease should consult a healthcare provider before supplementing, as magnesium can accumulate when filtration is impaired. Those taking blood pressure medications, diuretics, or certain antibiotics should monitor their response carefully. For many diabetics, correcting magnesium glycinate deficiency produces a noticeable shift. Blood sugar becomes steadier, nerves calm, circulation improves, sleep deepens, and daily energy feels more reliable. Magnesium glycinate does not act as a quick fix, but its steady influence helps restore balance across the systems diabetes affects most deeply. Zinc picolinate is one of the most critical minerals for diabetics, yet it is rarely discussed in everyday blood sugar conversations. Zinc is deeply involved in insulin production, insulin storage, immune strength, nerve repair, and wound healing. When zinc levels fall, blood sugar control quietly worsens, inflammation rises, and the body struggles to recover from even small stresses. In people with diabetes, zinc deficiency is far more common than most realize. Studies suggest that nearly half of diabetics in the United States have suboptimal zinc levels. High blood sugar increases zinc loss through urine, while chronic inflammation reduces absorption in the gut. Over time, the body slowly drains its zinc reserves without obvious warning signs. Early symptoms of zinc deficiency often appear subtle. These include slow wound healing, frequent infections, reduced sense of taste or smell, brittle nails, thinning hair, dry skin, poor appetite, and constant fatigue. Many diabetics also notice worsening nerve sensations, increased tingling in the feet, and slower recovery after illness or injury. These symptoms are often blamed on aging when zinc deficiency is quietly driving the problem. Zinc plays a direct role in insulin production inside the pancreas. Insulin is stored in beta cells in a zinc-dependent form. Without enough zinc, insulin becomes unstable and less effective. This leads to weaker insulin release, delayed glucose uptake, and higher fasting and post-meal blood sugar levels. Zinc picolinate helps restore this process by replenishing zinc stores in a highly absorbable form. The picolinate form binds zinc to picolinic acid, which significantly improves absorption compared to many other zinc forms. Once absorbed, zinc enhances insulin sensitivity by improving how insulin binds to its receptors on muscle and fat cells. Research shows zinc supplementation may improve insulin sensitivity by roughly 20 to 30%, allowing glucose to enter cells more efficiently. As insulin efficiency improves, blood sugar becomes easier to control. Many diabetics experience a gradual reduction in fasting glucose and softer post-meal spikes. Over time, HbA1c may decline by approximately half to 1 full percentage point in some individuals. Even modest improvements at this level can dramatically reduce the risk of heart disease, nerve damage, kidney decline, and vision loss. Zinc also protects blood vessels by reducing oxidative stress and inflammation. High blood sugar damages the inner lining of arteries, leading to stiffness and poor circulation. Zinc supports endothelial function, allowing blood vessels to relax and expand more effectively. Improved circulation delivers oxygen and nutrients to the feet, legs, brain, kidneys, and eyes, areas commonly affected by diabetic complications. Many people notice warmer hands and feet, improved balance, and reduced nighttime leg discomfort as circulation improves. Zinc's role in nerve repair is especially important. It supports the maintenance of the myelin sheath that protects nerves, helping reduce tingling, numbness, and burning sensations associated with diabetic neuropathy. Wound healing is another major benefit of adequate zinc intake. Zinc is essential for collagen synthesis, immune response, and tissue repair. Diabetics with sufficient zinc levels often heal cuts, sores, and skin injuries more quickly, reducing the risk of infections and diabetic foot complications. This alone can prevent serious long-term consequences. Zinc also strengthens the immune system by supporting white blood cell activity and reducing chronic inflammation. Diabetics often experience weaker immune responses due to prolonged high blood sugar. Zinc helps restore immune balance, lowering the frequency and severity of infections and improving recovery times. Dietary sources of zinc include oysters, beef, poultry, crab, pumpkin seeds, nuts, beans, and fortified cereals. Oysters are the richest natural source, providing several times the daily requirement in a single serving. However, many diabetics do not consume these foods regularly or absorb zinc efficiently due to gut inflammation. Zinc picolinate supplements are widely available and commonly used in doses ranging from 22 to 30 milligrams per day. Taking zinc with food helps prevent stomach discomfort. Morning or midday dosing is often recommended as stomach acid levels support absorption earlier in the day. Excess zinc intake above 50 milligrams per day for extended periods can interfere with copper absorption, potentially leading to anemia, weakness, and immune suppression. Very high doses may cause nausea, cramping, or a metallic taste. People with kidney disease or those taking certain antibiotics should consult a healthcare provider before supplementing, as zinc can interact with medications. For many diabetics, restoring zinc levels leads to noticeable improvements in energy, circulation, nerve comfort, immune resilience, and overall metabolic stability. Zinc does not act overnight, but its effects accumulate steadily as the body regains the tools it needs to regulate blood sugar and repair damage. Zinc picolinate completes the foundation created by magnesium and chromium. Together, these minerals support insulin function, protect blood vessels, calm nerves, and strengthen the systems most vulnerable to diabetes-related decline. When zinc levels are restored, the body regains a layer of protection it has been missing for far too long. Chromium picolinate is one of the most overlooked minerals in diabetes management, yet it plays a direct role in how insulin communicates with your cells. When chromium levels are adequate, insulin works more efficiently, glucose enters cells more easily, and blood sugar remains steadier throughout the day. When chromium is low, the system begins to malfunction quietly, often long before blood tests raise alarms. Many diabetics experience chromium deficiency without realizing it. Common signs include intense sugar cravings, constant hunger shortly after meals, sudden energy crashes, irritability, difficulty concentrating, unexplained fatigue, and that frustrating feeling of never feeling satisfied after eating. In the United States, modern diets heavy in processed foods strip chromium from meals, while high blood sugar increases chromium loss through urine. Over time, the body runs short without clear warning. Chromium's primary role is enhancing insulin's ability to transport glucose into cells. Insulin acts like a key, but chromium helps that key fit the lock properly. Without enough chromium, insulin binds poorly to receptors, allowing glucose to remain trapped in the bloodstream. This leads to elevated fasting glucose, exaggerated post-meal spikes, and a cycle of insulin resistance that feels impossible to break. When chromium picolinate is reintroduced, insulin signaling begins to sharpen. Studies show chromium supplementation can improve insulin sensitivity by approximately 25 to 35%. This improvement allows the same amount of insulin to move more glucose into muscle and liver cells, reducing the burden on the pancreas. Many diabetics notice fasting glucose declining within weeks, along with fewer dramatic spikes after meals. As glucose enters cells more efficiently, energy production improves. Instead of sharp highs followed by crashes, energy becomes smoother and more stable throughout the day. This is why many people describe chromium picolinate as reducing cravings almost effortlessly. When cells finally receive the glucose they need, the brain stops sending urgent hunger signals for quick sugar fixes. Chromium picolinate also influences long-term blood sugar control. Research suggests consistent chromium intake may lower HbA1c by roughly half to 1 full percentage point in some individuals. While this number may seem small, even a 1% reduction in HbA1c significantly lowers the risk of cardiovascular disease, nerve damage, kidney complications, and vision problems over time. The cardiovascular system benefits as well. Chromium helps reduce oxidative stress inside blood vessels, lowering inflammation that stiffens arteries. It supports healthier cholesterol balance by reducing triglycerides and LDL cholesterol while slightly improving HDL levels. As blood vessels become more flexible, circulation improves, delivering oxygen more efficiently to the brain, heart, kidneys, and extremities. Improved circulation often leads to warmer hands and feet, reduced numbness, and better endurance during physical activity. Many diabetics also notice improved mental clarity as the brain receives a more consistent supply of glucose rather than fluctuating highs and lows that impair focus and memory. Chromium also plays a role in nerve protection. Elevated blood sugar damages nerves by promoting inflammation and oxidative stress. By stabilizing glucose levels, chromium indirectly reduces this damage. Over time, some people experience reduced tingling, burning sensations, and nighttime discomfort associated with diabetic neuropathy. Kidney function may also benefit. Lower blood sugar reduces glucose loss through urine, easing strain on kidney filtration. Chromium's anti-inflammatory properties help protect delicate kidney tissue, which is especially important for diabetics at risk of chronic kidney disease. Dietary sources of chromium include broccoli, green beans, whole grains, beef, eggs, and grape products. While these foods provide small amounts, most diabetics struggle to meet optimal chromium levels through diet alone, especially when insulin resistance and glucose loss accelerate depletion. Chromium picolinate is the most commonly used supplemental form because picolinic acid enhances absorption. Typical supplemental doses range from 200 to 400 micrograms per day. Many people take chromium in the morning with breakfast, as it supports insulin activity during the daytime when blood sugar fluctuations are most pronounced. Excessive chromium intake above 1,000 micrograms per day may cause side effects such as headaches, dizziness, nausea, or excessively low blood sugar, especially when combined with diabetes medications. People with kidney or liver disease should use chromium cautiously and under medical supervision. Monitoring blood sugar closely during the first weeks of supplementation is advised, as improved insulin sensitivity may require medication adjustments. For many diabetics, chromium picolinate brings a noticeable sense of control. Cravings diminish, energy steadies, glucose readings improve, and meals feel less punishing. While chromium is not a cure, it restores a missing link in glucose metabolism that modern diets often neglect. Managing diabetes is not just about avoiding sugar, it's about giving your body the nutrients it needs to support insulin function, protect nerves, improve circulation, and maintain stable energy throughout the day. Minerals like magnesium, chromium, and zinc don't replace medication or healthy habits, but they play a powerful supporting role that many people overlook for years. If you're thinking about adding any of these minerals to your routine, always talk with your healthcare provider first, especially if you're taking medication or managing kidney or heart conditions. Small, informed changes made consistently are what create lasting results. If this video helped you understand your body a little better, please take a moment to like the video and leave a comment below. It helps this information reach more people who are quietly struggling with blood sugar issues. And be sure to subscribe to Diabetes Health Central for more clear, science-based guidance on managing diabetes, nutrition, and daily wellness. Thank you for watching, and take good care of yourself.